Well, welcome to our daily update on COVID-19 health and economy. My name is Tim Sheehy. I'm president of the Metropolitan Milwaukee Association of Commerce, and I'm joined by my host, Dr. John Raymond, president of the Medical College of Wisconsin. This webcast is brought to you by Aurora WDC. Each day, although we have changed that schedule now to Monday, Wednesday, and Fridays at 3:30, we bring you a 19-minute fact-filled update on the impact of COVID-19 on our health and economy. So thank you for joining us. And our special guest today is Dr. Patricia Hoban, who leads an organization called City Forward Collective. And she's going to give us an update of what's going on in K-12 across the city. So let's start with our update from Dr. Raymond.
Thanks, Tim. And before I start, I do want to clarify our revised schedules Monday, Wednesday, and Thursday at 3:30.
Yeah, sorry, my bad. Thanks for catching me.
Yeah, thank you. And thanks, Tim. We'll go over our indicators quickly. The doubling times in Wisconsin have extended out to 17.7 days and 20.8 days in Milwaukee. And the daily growth rates remain under 5%, with 3% in Wisconsin and 3.5% in Milwaukee. Now, today was a landmark day for testing in Wisconsin. We administered the most tests ever at 6,063, but unfortunately, we also had the highest positive test rates, both in Wisconsin at 528 and in Milwaukee at 297. The percent positive test rate for Wisconsin was 8%, and the rates pending in Milwaukee. And let me explain that we believe that one of the reference laboratories that the National Guard is using is having difficulty submitting their information. So some of the information that's coming in today are probably tests that were administered either last week or earlier this week, and we'll be paying attention to that. And I think most of you noticed that we did have a downturn in the number of positive tests and the number of tests administered the last 2 days. Now, our testing capacity did increase in Wisconsin to 14,140, and there was a new lab certified. So we have 53 labs doing the testing now, and there are 34 being onboarded. And again, we really hope to increase that testing capacity. Wisconsin hospitalizations for COVID-19 were up today to 393, although ICU hospitalizations for COVID-19 remained stable at 128. And we still have ample ICU bed capacity with 393 beds immediately available. And our ventilator capacity also remains stable and is adequate. PPE trends also are stable both in Wisconsin and Milwaukee, but those continue to be a recurring concern. And the reproductive numbers over the last 7 days were 1.1 in Wisconsin, that's stable, and 1.2 in Milwaukee, and that went down in a favorable direction from 1.3 earlier this week. Next slide, please. Now, every Wednesday, we mention some trending ideas about COVID-19, and the first idea involves thermal imaging cameras that are being used in Europe and Asia to scan individual temperatures before people enter buildings and businesses. And if a fever is detected, the person is typically denied entrance to the building. Now, these cameras also are being used in drones or have been incorporated into police helmets. In some cases, thermal imaging cameras have also been coupled with facial recognition software. Now, I'm not advocating for these measures, but I wanted to make you aware that this field is moving very rapidly. Next slide, please. Our next What to Watch involves a robot dog that patrols one of Singapore's parks as a coronavirus-related trial. And this machine's manufactured by a US company, Boston Dynamics, and it's fitted with a camera to monitor the park. It also carries a loudspeaker to broadcast social distancing messages. I'm really not sure how well this has been received, but it is something that's trending. Next slide, please. Now, in the next few slides, I just want to make you aware of MMAC's new health and safety toolkit. And I want to acknowledge the great collaboration that we've enjoyed between the M7 Medical College of Wisconsin and the MMAC to create sector-specific guidance for responsible resumption of business. And this toolkit focuses on educating and keeping safe our customers and workforce, and keeping our facilities as safe and healthy as possible. Next slide, please. This next slide simply shows a screenshot of the entry portal for the Smart Restart Business Toolkit, again, rolled out earlier this week by the MMAC. Next slide, please. And this last slide shows an example of a checklist. And these lists come with handy web links and educational materials that can be downloaded and used immediately for educating customers and employees. And this toolkit also helps us to understand how we can use social distancing, what sanitization procedures are best in breed for the specific sector of the economy, how we might consider new workflows and the incorporation of touchless technologies into the workplace, how we might work with public health officials to implement health screening in our facilities, work from home options, reconfigured offices, staggered shifts, virtual meetings, and reduced travel, all of which are really there to restore confidence in our customers and in our employees. Again, this toolkit shows the power of cross-sector collaboration. And before I turn it back over to Tim, I did want to draw your attention to the handout tab. As requested, I've included some information about how the reproductive number is calculated. I'm not going to talk about that today, but please download it if you're curious about the use of differential equations in public health. And now I'll turn it back over to Tim.
Thank you, Dr. Raymond. And again, thank you for the partnership all the way along, including the Smart Restart Smart Business Toolkit, and would not have been possible without the depth and expertise of your faculty that contributed to the work product. So thank you again to you and your team.
Thanks, Tim.
You bet. Let's pivot here and talk to Patricia. And a couple questions. First, Patricia, for folks that aren't familiar, can you talk to us a little bit about City Forward Collective? Then we're going to talk about K-12 and the impact of COVID on K-12 education in the city, and then a really exciting project that City Forward Collective has to help make a difference on the impact that COVID's having across our K-12 system. So let's start with City Forward Collective and what its mission and purpose is.
Thanks, Tim. Appreciate being here today, and appreciate what you and Dr. Raymond and others have been doing. We've all been watching and growing from it, so thank you. City Forward Collective launched last July, and it emerged from two organizations that had long been supporting K-12 education across the city. One is PAVE and one is Schools That Can Milwaukee. We renamed the organization and relaunched with a new mission and vision, but the mission is simple. Our idea is to ensure that all children in Milwaukee have access to high quality seats, and also to eliminate the inequities that limit the experience, the type of experience and the type of opportunity children across Milwaukee can have. And so we do that by three main strategies. One is talent development, and this was work that had been done in our parent organizations, or where we emerged from Schools That Can in particular. We've worked for over 10 years developing school leaders, and more recently, we've launched an initiative to recruit Black and Brown teacher talent in the city to serve our children. The second area, which is new to the organization, is policy and advocacy, trying to identify what are those areas that are limiting the access that students are having to high quality schools, and eliminating some of the inequities, particularly around how much funding different types of schools in the city get. And then the work is bolstered by strategic investments in high quality schools. We'll be expanding and helping support national fundraising for and local fundraising for the expansion of existing high performing schools, bringing in other entities and incubating other entities, and helping to support promising schools. So that's the summary of what we do.
That's great. And can now, I think you have a really good perspective, because you're one of the few organizations, maybe the only one that I know of, that works across the entire spectrum of K-12 education in the city. And we've got 118,000 students in the city. A little more than half get educated through the Milwaukee Public Schools, about 15% or so educated through independent public charter schools, and about 24% or so through private schools in the Milwaukee Parental Choice Program. So talk to us a little bit about the impact of COVID-19 on education in the city of Milwaukee for K-12 students.
So thank you. So what you just pointed out is an important lead statement. We have a collection of three different school sectors in this city. And I think people don't realize that only 55% of the students are in Milwaukee public schools. And so what happened on March 15th or 16th when the governor announced schools would be closed is it quickly became apparent the differences in how these different sectors operate. So my first question was, my first step was to reach out to school leaders and go, what are you going to do? Are you going to be remaining open? Are you going to be offering, remote education? What's the plan? There was nobody telling schools what they needed to do. So at the state level, the governor closed the schools. The Department of Public Instruction started giving waivers to things like state testing, helped people see that they had a website for remote learning resources, but no guidance as to whether you should be teaching or not in the schools. And what happened is in Milwaukee Public Schools, they decided to close the schools for 3 weeks through school spring break, hoping that they would reopen after that. The charter and choice schools took a different approach and immediately started working with families and kids and trying to figure out where they could get resources to do remote learning. And what we quickly saw is the smaller operating unit, the individual schools or the small networks of schools that we see across the charter and choice sector, were able to operate more nimbly and quickly get up to speed. I also think what was revealed in our city is how important it is that teachers have relationships with students and families. And where you see the most success across our city over the last 8 weeks is where those relationships were clear. Students were coming to school when it was in a building because they had those relationships. They wanted to be there to learn. And so those were able to be transferred. And so now what's happening is 2 weeks ago, MPS brought their teachers back. But some of their high schools are already closed for the year because they're on a different schedule. And so some schools, you have teachers delivering instruction, new learning, so there shouldn't be a large gap. And others are still handing out worksheets. And so the inequities and the differences in terms of performance and opportunity that were already great are just being highlighted to where we are today.
So this is not only going to be a challenge for us in this school year, this is a lag in a sense that's going to carry forward for the next couple years, and that's the concern, isn't it?
Right. So the Northwest Education Association did some research looking at test scores in the elementary school grades and how much learning loss normally already happens over the summer, and particularly for low-income students. So combined with the learning loss in the spring for over half of the students in our city, starting the year, it could be taking them as much as a year to a half a year behind, depending on the subject. And so we can't let that happen, and so there are different opportunities that we want to invest in locally to ensure that that doesn't happen. One of the things, if I can just speak to what we've been doing, so we've been convening hundreds of school leaders and teachers now on a regular basis virtually, providing tools and resources and training on how to do remote instruction. We've been bringing in national experts to do that. So not unlike what you've been doing with the business community, we've been doing now for 8 weeks. We raised $750,000 for a COVID school support relief fund, and we want to focus that fund on recovery and hopefully reinvention, which is where we all need to go, and that's only highlighted what's happened with COVID. That's where my optimism comes in, is revealing what's really underneath the covers here is going to allow us to call it out and build around it. So we want to be investing throughout the summer in helping people develop plans for reopening and addressing that learning loss that they're going to have without holding back on what should normally be happening next year in terms of learning. And then we've seen some schools this spring who have really brought to life some strategies with remote learning that need to be scaled, not only for how the year is going to operate next year, where we all believe we're going to be in and out of virtual learning, but also to create long-term innovations in the education sector. So the areas of recovery and reinvention are where we want to invest those funds, and then supporting schools in planning. And the last thing I want to say about what needs to happen is, going back to the beginning, we do not have a citywide governance structure for education. We have a collection of independent operating units. We had a chaotic school closure where some kids were getting learning and resources and others still are getting nothing. And some of the problems of internet access and those things can be solved, but we cannot let the reopening look like the closing. So we need to bring together, in much the way you have, public health officials, our school leaders from all three sectors, and figure out how are we going to open the school. We can't have children in one school going to school Mondays and Wednesdays, and in another school, but from the same family, going on Tuesdays and Thursdays. And so that is the next step for us, is to facilitate and launch a citywide effort. And we hope the business community will join us in this, the childcare community. We all have to be thinking about this together.
Yeah, Patricia, and as you know, we're in. And so, again, I'm going to bring Dr. Raymond in here. We're going to go to questions from our viewers. And again, if you're interested, you can reach out to City Forward Collective. Chris?
Yeah, one of the first questions we got was for Dr. Raymond, and that's, would you allow your child to play Little League Baseball this year? I'd also like Dr. Homan's opinion on what schools can do to encourage students to get some physical activity safely during this time.
My kids have aged out. They're a little too old for Little League Baseball. I probably would, but that's not a medical opinion. It's the opinion of a father. And I would probably have them wear masks and bring hand sanitizer and be careful. But I think baseball is a non-contact sport, so it's probably one that's lower risk.
And catchers already have masks. Patricia?
I'm not the expert on this. I just have to say I've seen in my neighborhoods families of children playing together without masks, kicking balls around, and I think that whatever guidance we can provide. I had an encouraging call today with Kathy Thornton-Bias at the Boys and Girls Club about some of the programs they're hoping to open up this summer, which I think will be a real opportunity for families in a structured environment where we know public health provisions are being thought through, and proper supports will be in place for the children. And so I guess my recommendation would be a more structured environment and wear the masks and the gear.
Dr. Homan, I don't know if you got a crystal ball there at your desk, but people are wondering what you think that in-person instruction, if possible, might look like this fall for K-12.
What we're telling people is don't presume in-person instruction. I think that when you look at some of our central city school buildings and the packed number of students that are already in classrooms, and way too many of them, there is no way we're not going to be doing at a minimum a combination of remote and in-person learning, be it that it all starts one way and ends another, or that certain high need students go to school first and the other ones are having remote learning. So I think what we are making sure people do is they have a 12-month plan that could look like a series of disruptions, and that we want that to happen without schools missing a beat when those transitions have to happen.
Dr. Raymond, question for you. We heard from a business owner in Pewaukee who's having an issue with employees who have symptoms being unable to get a test through their private provider and looking for a little advice. Would this be a place maybe for their local health commissioner to step in?
Yeah, it's a good question. In Milwaukee, you can call 211 in Milwaukee County. And we do have the National Guard testing sites through this week that all you have to do is drive up and say you want to be tested, and it's done for free. That won't last forever, but those would be some options. Again, I think if you can't do any of those, then calling your local health department would probably be the next place to go.
And finally, a question for Dr. Hoban. Are you familiar with efforts in the city to get laptops and access to the internet out more broadly to students who are lacking that?
So Laptops are not the issue that internet is. So MPS had 70,000 laptops. They have 66,000 students they're responsible for. So there it was more, how do you disseminate? How do you, connect with families? I know Tina Chang, MPS, Tina Chang from the business community and others have been looking at how do we ensure at least the next year or two of internet access. This is, having access to the internet is part of a road to the middle class. And this is the kind of inequity that we've seen in our community. It's guided the expectations we've had for student learning for way too long. And I would call that low expectations for absence the internet. So I think we need a long-term solution. If we come at this just how can we get 5 months of hotspots and this, that, and the other thing, we're not going to solve this. We need to come up with a new way to provide citywide internet service. The laptops will come, and in most cases are there, and I think there's resources for that. The internet service is going to take a strategy and a looking at business plan options for that, that we need to take very seriously and we need to do now.
Well, Patricia, thank you very much for those thoughtful insights on a very important area for the entire city, K-12 education. Dr. Raymond, thank you again for joining us, and thank you for helping me on the program correction. So again, Monday, Tuesday, and there we are, Monday, Wednesday, and Thursday. So we're clear on that. No Tuesday, no Friday. So have a safe and healthy rest of your day, and we'll see you tomorrow.
Thanks, Tim.